In today's video, my dear woman, I will be giving you a lot of information about best vitamins that can help you prevent stroke. Stroke is one of the most dangerous diseases, especially women after 50 years and older. And in today's video, you'll be learning a lot why you're getting stroke, what statistics say in today's modern world, best vitamin, of course, how you can take them, and best sources in the food of those vitamins that really can help your brain. A stroke happens when blood flow to the part of the brain is interrupted, either because of blood vessels is blocked, this is called ischemic stroke, or because the vessels burst, hemorrhagic stroke. For women over 50, there are several common contributing factors. First one is going to be high blood pressure. Atrial fibrillation, this is irregular heartbeat. High blood cholesterol. Diabetes. Smoking, including past smoking. Obesity, physical inactivity. Then unhealthy diet, especially high in saturated fats, salt, and processed food. After menopause, some protective hormonal effect lessen. Arteries may stiffen. Risk of hypertension increases and cholesterol level often shift unfavorably. Body fat disrupt changes, and all this makes stroke risk higher. Preventing stroke is not just about avoiding death, it's about preserving brain function, memory, mobility, and independence. And we live in the modern world that each year the higher risk is from the stroke. Stroke is unbelievably dangerous. That's why it's so important to take precaution measures, especially physical activity, good quality diet, and of course best natural remedies in the world. Now let's talk about the statistics. Let's talk about the number. Tell us in recent decades for stroke incidence, prevalence, and deaths in the United States, according to the 2025 Heart and Stroke Statistic Update by American Heart Association. In 2022, strokes caused 165,393 deaths in the United States. In that same report, accounted for about 1 in every 20 deaths in the United States. So even tough medical treatment and acute care barrier, the burden of stroke remains very large, especially on older adults, especially in the women after 50 years and older. If you understand me correctly, this is 1 in 20 deaths, especially in the United States. Similar kind is, of course, in the Europe, are from the stroke attack, and that is why I need to avoid it. Let's talk about a little bit more about the most important vitamins. These vitamins can help reduce things like homocysteine levels, inflammation, oxidative damage, factors that contribute to the stroke risk. Here's why I recommend it. Always after checking with your healthcare provider. You will need vitamin B complex 50 mg per day 3 times daily, extra vitamin B3 and niacin 50 mg daily, plus extra vitamin B6 pyridoxine 50 mg a day, and extra vitamin B12 about 1000 micrograms per day. Those are relatively high, especially vitamin B12, so medical supervision is very important. In the short, that means, my dear viewers, dose what I recommended is a bit higher dose than is recommended. That's why you all need to consult with your healthcare provider, your doctor, your medical professional that works with you, and those medical professional knows your medical history and can help you with those vitamins. This is in general, you will need vitamin B complex, especially with other vitamin B extra, and this is what really going to help you with preventing the stroke. To understand why those vitamins are proposed, we need to know about homocysteine. Homocysteine is amino acid in the blood. Normally, it is metabolized, broken down by pathways that require vitamin B6, vitamin B9, and the vitamin B12. If you have low levels of those vitamins, homocysteine can accumulate. High homocysteine levels are associated with damage of blood vessels lining, promotion of the clot formation, increased oxidative stress and inflammation. Those in turn can increase risk of ischemic stroke. Some epidemiological studies shown elevated homocysteine is a risk factor for stroke, independent of other risk factors. The extra B complex B3, B6 and high-dose vitamin B12 help ensure all the metabolic pathways are working well, keep homocysteine level in the safe range. That is unbelievably important. For everyone who understands anything about nutrition and natural remedies and prevention of stroke or heart attack knows that those homocysteine levels must be in check, especially for women after 50 years and older. And the main reason why those homocysteine level is be alright is going to be take those vitamin B complex together, especially after 50 years and older. Especially you after 50 years and older, your digestion don't work well for many women, also the men, and when you take good quality vitamin B's, most of them you will not metabolize correctly. That's why you need a bit more of vitamin B each day. Here are guidelines from my years of research and what literature suggested. Start with vitamin B complex 50 mg 3 times per day with meals, morning, midday and the evening. Add niacin or vitamin B3 50 mg a day. Note, niacin can cause flushing. If that bothers you, you may start with lower dose and gradually increase. Also check with the doctor, especially if you have liver issues or take statins or other medications. You can add vitamin B6 or pyridoxine 50 mg daily. High doses over a long time can cause nerve issues in some people, that's why you need monitor. And add vitamin B12 in the range of 1000 micrograms a day. This is very high dose. This helps especially if there is evidence of deficiency or absorption issues that is common after 50 years old. Also take vitamin B complex with food for better absorption. If you are on medication, for example cholesterol, for stroke prevention or anticoagulants, etc., always inform your physician of supplements. Some interactions can happen. Periodic tests of blood are helpful to check vitamin B12 level, kidney functions, liver functions, homocysteine level. It is possible, and this is what you need to remember. Always check with your doctor. If you don't have if you don't trust your doctor, you try to find someone who also are very educated about nutrition, natural remedies, in the classical medicine that can help you. So this is in the supplement form, but even better is going to be for you in prevention. Eat food that contains a large quantity of vitamin B complex. Here are 20 food rich in vitamin B complex, especially in vitamin B3, B6 and B12, that you can include in your meals. Natural food sources help more than supplements alone because of co-nutrients. Here's the list. Lean poultry like chicken and turkey, fish like salmon, tuna or trout, shellfish like clams and oysters, liver, beef or chicken, eggs, dairy products like milk, yogurt and cheese, fortified cereals, legumes like beans, lentils, chickpeas, nuts like almonds and walnuts, seeds like sunflower seeds or pumpkin seeds, whole grains like brown rice, oats and barley, green leafy vegetables like spinach and kale, potatoes with the skin, bananas, avocados, mushrooms, especially morel or portobello, peas, lean pork, turkey breast, nutritional yeasts. How include them? Add to breakfast fortified cereal or whole grains with the eggs or yogurt. Snack, handful of nuts and seeds or legume-based dip like hummus. Lunch or dinner, fish or lean poultry, a big side of leafy greens, whole grains and legumes. Use mushrooms or avocado for flavor and vitamin B variety. Make sure to rotate so you get variety, not always the same food, but there is a lot of those examples of good quality food that contains vitamin B complex and really can help you. Did you understand me, my dear viewers? Vitamin B complex are really friend for your brain, generally in the health, especially in the prevention of the stroke. Stroke prevention is not magic, it's about taking small, evidence-based steps, controlling blood pressure, cholesterol, maintaining healthy weight, staying active, and nourishing your body with the right vitamins. By using a strong vitamin B complex plus extra B3, B6, and B12, you help maintain low homocysteine, support healthy blood flow, reduce clot risk, support nerve and the brain health. Always remember, if you have risk factors, have had strokes before, or on medication, always check with your medical provider before starting high doses of supplement. That is unbelievably important. For everyone who wants to learn how to prevent stroke, or if you want to learn how you can go better in the safe, natural way, if you already have the stroke, call +385 98 917 9200 Mario Lab Center in the Zagreb, Croatia. I work with the patients almost 26 years right now, and my specialty is going to be nutrition, natural remedy, and physical therapy and rehabilitation. You can come to my office, this is perfect. Also, you can use me in the phone consultations. In both those ways, I will make sure you get perfect natural, my program of nutrition, natural remedies. Even you will receive my natural remedies directly on your home address. And if you listen to me, and you can help yourself with the knowledge of nutrition and natural remedies in prevention of the stroke, especially in women after 50 years and older, safe, natural way with any kind of side effects. Thank you for following, my dear viewers. God bless you. God bless your family. See you in the next video. Bye bye.